Hello YouTube, this is Kez Maina. Welcome to my YouTube channel. This is a health and lifestyle channel where we talk about different health conditions and lifestyle modifications to accommodate the same. So today we are talking about yeast infections and the connection between yeast infections and yogurt. Yeah, so we'll start by defining what yeast infections are, and this is a group of fungal infections that affect the mouth, the vagina, which is what we're going to talk about mainly, and the GI, which is the least common place that is affected. And then we'll talk about, I'll bring yogurt in a little bit, and the reason why I'm bringing yogurt in is because yogurt has something we call probiotics. Probiotics, like these do I call them the good bacteria? They are live organisms, bacteria that are naturally present in our vagina or vulva, in the GI, intestines, and in the mouth. They are naturally present there, and they help maintain a good balance and good functioning of those three systems that I've mentioned, and they help maintain a healthy sort of environment. Like for example, for the vagina, it helps maintain a healthy discharge, and for the mouth, it helps maintain what? A clean mouth. I mean, a healthy mouth, I'd say that. Yeah, so yogurt has probiotics, and probiotics is what I've just talked about. So it has what we call normal flora. So probiotics are sort of normal flora, and they are present in yogurt, but you can buy them outside here. But natural source yake ni yogurt, and there is maziwa mala. Hata mursik I think iko na normal flora. Muniambie, sijui, siko sure, but I think it does because it's the same concepts. Soy milk, I'm not sure, but maybe not. Yeah, so having done that, now we go into how yeast infections come about. And this, I will say it comes about normally. I'll start with the vagina. Normally your vagina has an acidic pH, an acidic pH, and the normal flora your good bacteria yenye tumeongelea, it survives very well in an acidic pH, which makes it function well and give you a healthy discharge down there. So when the pH is destabilized, and this can be destabilized by quite a number of things, including douching. We mentioned douching some time back, and I'm going to mention it again, including douching as well. If this happens, it makes that local environment not conducive for the normal flora. When that happens, the normal flora sort of gets eroded, and when it's eroded, yeast cells, the fungus, get a chance to crop up and grow and cause you an infection. That is one. Yeah, that is how yeast infections do come about. And we are going to talk about the predisposing factors a little bit down hapo chini. So after that, we are going to talk about the signs and symptoms, and we'll start with the vagina. Vaginal candidiasis, vaginal yeast infections, zina present with vulval itching, that is itching on the outside of your vagina, not inside, but you may feel some discomfort on the inside. You may have soreness and pain. Sometimes you may have a burning sensation when you're urinating. This is because when there is that thrush, you tend to have some laceration, and definitely urine has some sort of acidic, some sort of, what do I call it, inachoma kidogo. So ikipata mali kuna a broken skin, it's bound to burn ama irritate or be painful. You may have painful coitus, pain during sex. You may experience that as well. And then what is commonest is the whitish vaginal discharge that is curd like, inakaa maziwa mala. I wish I had maziwa mala here. Inakaa maziwa mala. But if you ask someone, ama if you have such kind of a discharge, and it's usually odorless, ainanga harufu at all. It's odorless and it's kind of sort of sticky and it's white. If you get that kind of a discharge with all the above symptoms zenye nimewaeleza, you most likely have a vaginal candidiasis. And then oral candidiasis will present with a whitish layer of plaque on top of your tongue, or even on the sides of your cheeks. That is the mucosa of your mouth, your membrane ya mdomo yako. You may present with that. Sometimes inaweza kuwa painful, but that is if it has stayed there long. But usually oral candidiasis is not very common. And then there is a yeast infection that affects the GI, that presents with diarrhea and abdominal discomfort. It's not very common. It's a very rare finding, and sometimes it's an incidental finding when someone comes with other symptoms, like for example they have amoebiasis and a stool test is done, so utapata amoeba zimepatikana hapo, alafu pia kuna yeast cells zimeonekana hapo. But it's not very common, and sometimes the GI yeast may not even cause symptoms at all, but ikisababisha it may need treatment after all. Yeah, so symptoms ni hizo. And predisposing factors, this would be where I mention causes, but cause ni fungal. There is no another way around it, it's fungal. So with the predisposing factors, we will talk of, first of all, a low immunity, an immunocompromised individual, someone whose immunity is not very much okay. This can be an opportunistic infection. Immunity yako ikiwa chini, some of these infections tend to crop up. And then there is poorly controlled sugars in a person who is diabetic. And while I'm still on that, I'll also include that too much intake of processed sugar may predispose you to recurrent yeast infections, some yeast infections mara kadha, which I think is something that can be avoided. And then douching. We talked about douching on our very first video. Douching is a wrong practice. Remember how I told you yeast infections may occur, erosion of the good bacteria. Like for example, if you douche, ukiamua kuosha ndani yako with water ama even scented soaps or whatever it is you may decide to wash yourself with, it erodes the good bacteria that maintains that balance. Ikierode hiyo, sasa before your good bacteria grows back up again, you may find yourself growing some yeasts huko chini. Another thing is too much unnecessary use of antibiotics. If you do not need an antibiotic, do not use one, do not get one. There's no point. And there's no point if you do not need an antibiotic, wachana nazo, because antibiotic ukimeza haijui the difference between this good bacteria that we are calling the good bacteria and the bad bacteria. So inafagia kila kitu. Again, remember, we said ikifagia kila kitu, again, the good bacteria dies. When it dies, yeast cells zinapata chance ya kuthrive ama kugrow vizuri. What else you need to avoid is wearing very tight pants ama trousers, and avoid staying in wet clothes for very long periods. Like for example, swimsuit. Ukimaliza kuswim, toka kwa swimsuit, oga, change into dry clothes. And while we are still on that, change your pad or panty liner in time, because of that hiyo unyevu, the wetness, it's not a good medium. It tends to, the wetness is what I'm talking about. It tends to create a good environment for the yeast. And okay, today I'm not talking about bacterial class of infection, but it may also cause bacteria to grow that may cause you infections in your vagina. Yes, what other predisposing factor have I forgotten? Pregnancy, okay. This happens because of the hormonal changes that happen during pregnancy. And this may occur because, okay, most of the time when you're pregnant, the hormone progesterone goes high. But for some reason, or in some people, estrogen too may rise. Hata, I think they zinapanda pamoja, but progesterone goes higher. When that happens, it tends to, high estrogen levels tend to encourage growth of yeast cells. And well, we are still on the hormone bit, some of the point on hormones. I'll mention that postmenopausal women are not very much affected by yeast infections because at menopause, production ya estrogen kwa mwili yako, because umefika point, umefika stagnation, iko chini. So with reduced estrogen, that means your chances of getting yeast infections are lower. Well, unless you have these other problems that we're talking about, okay? After the predisposing factors, I think I've mentioned all of them, and if I've not, sijui naona kama nimemention zote. So after that we go into the prevention, and prevention includes now avoiding all the above predisposing factors. You avoid putting on very tight pants, you avoid too much sugar, you avoid you try, if you're diabetic, make sure you're controlling your sugars well. If you control them well, trust me, you're not going to get yeast infections as frequently. Avoid too much use, unnecessary use of antibiotics. And also, what else? Nini ingine nimesahau? I don't know. Drink yogurt. Yogurt iko na probiotics, like I've said before. Iko na take lots of yogurt. Like I take yogurt almost on a daily basis. I'm not telling you to take on a daily basis. Me, I take yogurt because I'm lazy. I can't cook daily. But you can take yogurt as a supplementation. I take it as a meal. You can take it as a supplement to your regular meal, okay? Yeah. So from prevention, we go into diagnosis. And diagnosis, first of all, the first thing, it's clinical. Ukinikuta uniambie vile unasikia ama how your symptoms are, I'll be able to think this is a yeast infection. Second, now for the vagina, for the vaginal candidiasis, sorry, I'm a vaginal yeast infection. After now the clinical, ama you've given me your history, next I'll need to examine you. I may do a VE ni vaginal exam, tunapima, tunaangalia, I'll check your discharge, how does it look like. We even smell your discharge, by the way. We are weird. Yeah, we smell, and that alone can help me make a diagnosis. But if I'm still having doubts, I can take a sample of your vaginal discharge and send it to the lab. This will be analyzed na wataniambia kama wameona yeast cells ama kuna vitu zingine ambazo wameona zinahitaji treatment. From there we continue. Diagnosis for oral candidiasis, that is clinical. Nita examine tu, nitajua hii ni oral candidiasis and go ahead and treat. Not candidiasis, yeast infection affecting the GI. That one is just, will be found if a stool test is done. You can't just tell me you're having abdominal discomfort and diarrhea and I'll decide you have yeast cells in your stool. Hiyo itahitaji kupimwa. So yeah, and treatment ni antifungal. It's a fungal infection, so treatment yake ni antifungal. And maybe to try and avoid getting that is intake of probiotics. And that is it. And I think we are done. But before we go, I want to mention one more thing. I didn't know where to put it in all this, but I needed to say that candidiasis, vaginal candidiasis, now is what I'm talking about, can be transmitted sexually. but it's not classified as an STI. It can be transmitted. Like for example, if I have a yeast infection, it is likely, especially if it's very recurrent and niseme ni mbaya, I can pass it on to my sexual partner or my male counterparts, assuming he's male, and he will also require treatment. Yeah, so treatment includes oral and maybe topical antifungals, and your male counterpart may need to be treated. All right, I think we are done at that. Thank you so much for watching. Remember to subscribe, watch our previous videos, especially the one on vaginal douching. Remember to watch that because I feel like they kind of go along with this one. Yeah, so thank you for watching. See you next time. Yeah, bye.